facilitating and moderating today's session. So just to welcome everyone, we will give just some few minutes, 5 minutes for others to join. So please just stay around as we wait for others to join. Please, as we are waiting, make sure that you are muted so that we don't distract the presenters. I will also request that you introduce who you are, your name, the country where you are coming from, and then also the organization you present. Thank you so much, everyone. I'll be coming back in about 4 minutes' time. Thank you.
Salam.
Good afternoon. If we can all mute ourselves, please. If we can stay muted, would appreciate. Thank you so much. Once again, good afternoon, everyone, or good morning from wherever the part of the world we are. EANASO, the Eastern Africa National Networks of AIDS and Health Service Organization, based in Arusha, Tanzania, with our partners, Frontline AIDS, GIZ Backup, Stop TB Partnership, and the Global Fund CRG department are very happy today to host this training on community-led monitoring. We are really happy to have you once again, and this is a follow-up call from 2 weeks ago where we were launching the community-led monitoring guide, which the partnership has developed. Because we didn't have enough time for discussions and to finish the presentations, we found it good that we should have another conversation around community-led monitoring. So we are very pleased to have you all here. Today, what we really want to do is to orient everyone, our participants, civil society communities and partners around what we understand as community-led monitoring. We also want to take you through the community-led monitoring guide, which talks around how to integrate community-led monitoring in funding processes. In our example, we've taken Global Fund, but we know that we can use other opportunity funding mechanisms as well. My name is Olive Mumba, and I'll be moderating the session today. And I am very happy that we have a panel comprised of Richard Lusimbi. Richard will be providing us with opening remarks. Richard is the executive director of an organization in Uganda called SMAG, but he is also the coordinator of the Uganda Key Population Consortium. We will be hearing from him. He'll give us 5 to 6 minutes opening remarks. Immediately after that, we have a short video around community-led monitoring from the Global Fund, which we want to share with you all, that actually explains why community-led monitoring is key. After, we will hear from Keith Mearnes, who is from the Global Fund Community Rights and Gender Department team. And Keith is the technical advisor of community systems and responses in the community. He is also leading the community-led monitoring strategic initiative, and he will tell us more about that. We will then open up for everyone to be able to, we will have a Q&A session. And immediately after the Q&A session, we will then move on to Ms. Rhoda Lewa. Rhoda is a technical consultant who supported the team to develop the CLM guide. She has 2 presentations she will make, and soon after, we will have another opportunity for discussion. Just to mention, in terms of what we are going to be discussing today, as said, we are going to unpack community-led monitoring as an integral part of community system strengthening. We will also be looking at advocating, consolidating, and safeguarding community-led monitoring during the grant-making processes, but also during the fund request development process for those that are still within the initial stages. So we will also be unpacking that. And at the end, we'll also be talking about how to operationalize community-led monitoring. So that is the agenda for the day, for our session. So I will kindly request that we stay muted so that we provide space for the speakers to be able to be heard. If we have a question, kindly put your question in the chat box. And the other thing is, please introduce yourself, your name, the organization, and the country that you come from. If there is any point that at any point you need anything, let us also know, use the chat box. And it is with that now, I would like to invite Richard Lusimbi to provide us with his opening remarks. Richard, the floor is yours.
Thank you very much, Olive, and colleagues who have joined us this afternoon. Mine is really, I'm so delighted that I'll be speaking with everyone and sharing our experience in Uganda and some of the things that we have been using to follow up when it comes to CLM. So CLM, like we had from the last conversation, may look like it's new, but I just want to say or put a disclaimer. I think right now it seems like new. It's because we are having the bigger funders, the Global Fund, and PEPFAR paying attention and paying interest in it. But I think we as communities, we've been doing this community-led monitoring in our ways. Quickly, I just want to say that the reason why, for example, in Uganda, when you talk about community-led monitoring, is to give the communities the ability to monitor the quality of service provision and escalate the performance problems as in this strategy for improving the HIV programming in the country. And again, this is also looking quickly at the center to make sure that all people with HIV can live a healthy life with, again, dignity. So we kind of have some common principles that have been guiding us in terms of how we conduct our CLM. And again, this talks to something I've already mentioned, which is community empowerment or the empowerment of community, but also people living with HIV and KP communities being at the center and the drivers of this work, making sure communities are involved and they're included, but also for sound integrity, transparency, and accountability. But again, the reason why we do CLM, a key principle here is ensure that whatever we say, whatever advocacy we bring out or speak about is evidence-based, also ensuring that there's feedback, learning, and adaptation. So quickly, those, if you look again, those are some of the key principles that drive us to do what we do. And again here, I just want to specifically speak and say that whatever we do, CLM is all about communities. Communities being at the center, communities being at everything we do. And also I want to say that CLM is not about community becoming fault finders. And I think I said this when it comes to PRs, when it comes to prefer implementing partners, usually when they listen or hear about issues around community monitoring, they look at it as there comes the communities who are coming to do fault finding. But the whole reason why you do community-led monitoring is one program in country to ensure that what a global fund says it intends to do in the country is happening, but also to ensure that those services are of quality and they are meant for both peers and anyone who is involved in the program. But also, I must say that community-led monitoring gives us a bridge as a community to engage with CCM board members, but also with peers in the country, but also the communities. I'll give an example quickly, what we did back in Uganda. For example, when we had COVID-19, we all know that we're still dealing with the pandemic. And because of the community involvement and community-led monitoring, we're able to bring out the issues that were affecting our program when it comes to key populations. And because this was very clear and we were speaking with evidence, Global Fund, together with the peer and together with the CCM board, and I'm so glad our CCM board chairperson is online right now, Dr. Maggie, Professor Maggie Chigozi, she's online right now. We were able to have resources approved to speak to some of the issues that we're bringing out that were affecting the key populations in the response of during the response of COVID-19, but also resources put aside to reach out to communities or people living with HIV. So in a nutshell, what I want to say this afternoon as we start this very wonderful conversation is that communities have always had the power to do this. And it's now my call to Global Fund that community structures and community processes are more funded to ensure that this work is done because it involves routine or rapid assessments, it involves dialogues and conversations. And again, when you talk about policymakers, if you find stockouts in a community, then that means there must be a dialogue to discuss issues around supply chain. So again, all this will only come and be important and fulfilled if all stakeholders come on board. But quickly, I just want to say, I think CCM board with support of our chair and also Global Fund team for the country in Uganda has been very, very responsive. And I think the more communities have dialogue with their governments, the better it will be, because like in Uganda, the Minister of Health is on board, Uganda's Commission is on board, and the different partners are getting on board. And I think that's where we want to be, so that again, like I mentioned earlier, we take away the concept of thinking that CLM is causing communities to be getting into the business of peers or other implementing partners. But we should understand that CLM is just putting the people, the communities at the center of everything that we're doing in the HIV response, in the TB response, and the malaria response. I thank you, and over to you, Oliver. Thank you.
Thank you so much, Richard, for just opening through the experience, the Uganda experience. And thank you so much for letting us know that the chair of the CCM Uganda is also here. And I think we have a lot of key people participating in this webinar. So we will now want to start to move on. We will be having the next speaker, who is Keith. Can I request that the key discussions that are on the screen, if that can be removed, so that we can provide Keith with the opportunity to share his presentation. Keith, just come on in and reintroduce yourself for those that didn't hear me introducing you. The floor is yours, Keith.
Thank you so much, Olive. And hi, good afternoon, good morning, everyone. I hope you can see me. My name is Keith Minis, and I'm a technical advisor for community systems and responses in the Community Rights and Gender Department at the Global Fund in Geneva. And I'm also the CRG regional focal point for High Impact Africa 1. Olive, I'll share my screen, but I'm just wondering, you did say earlier you will start off with the video, the CBM video.
Oh, yes. Oh, yes. Thank you so much for reminding me about this CLM video. Yes. Rhoda, can you kindly put on the CLM video? Thank you, Keith. Thank you for reminding me that. Rhoda, we can't hear the sound. We apologize, we're having very bad internet from Tanzania, so we have requested our colleagues to kindly help us put up the presentation. Yeah.
So, go ahead.
Olive, excuse me, this is Yvonne. I think we can share here on our side and the video can play.
Okay, so kindly do that. Thank you, okay. Yvonne. Thanks for that.
All right, thank you. Thank you.
With malaria. They ask her to pay for the medicine. Meet Lulu. Lulu is pregnant and living in an area with high rates of malaria. She has night sweats and a fever and suspects she has malaria. She goes to the nearest clinic and is diagnosed with malaria. They ask her to pay for the medicine, which is supposed to be free. She doesn't have enough money and doesn't know what to do. Meet Nicholas. He is a gay man living in a country where same-sex behavior is criminalized. He is living with HIV and now suspects that he has TB and is afraid to go to the clinic because he heard the healthcare workers discriminate against gay men and gossip in the community, putting him at risk of arrest. Lulu and Nicholas are facing some of the barriers that people face when trying to access health services. Community-based monitoring, or CBM, is one way to make quality services more accessible to everyone. CBM involves service users and/or local communities gathering, analyzing, and using information to improve access to quality services, better target resources, and address human rights and gender-related barriers to services. Let's look at one example of CBM. A community organization identifies stockouts of essential medicines. They develop a system to document when tests, diagnostics, and medicines are not available. The community data collectors also interview service users to show how stockouts affect their health. The organization then brings the data to decision makers to jointly come up with a plan on how to prevent future stockouts so people can get what they need on time. Another example. An organization of transgender women decides to document violence experienced by their peers. They monitor what violation took place, where it took place, who the perpetuators are, and what services were provided to those who sought support. Then use the evidence to advocate for programs such as trainings of police, paralegal support, or Know Your Rights campaigns to prevent and better respond to instances of violence and follow up on the outcome of the support provided. CBM creates an efficient feedback loop. The granular data collected allows communities and decision makers to collaboratively solve issues as they arise in real time. CBM should not be confused with a one-off community consultation, traditional monitoring and evaluation that feeds into national reporting systems, or monitoring of communities delivering services. Instead, CBM involves ongoing feedback on issues identified and prioritized by communities, with the goal solving those issues at the local level whenever possible or elevating to higher level decision makers when necessary. CBM can help people like Lulu, Nicholas, and many others lead healthier, more productive lives.
Thank you very much for giving us that introduction around CLM or CBM. Now let us quickly move on to Keith. Keith, the floor is yours.
Thank you. I just couldn't find the buttons. So hi again, everyone. I guess you can see me now in my slides. I'm just going to make this full screen. So just to recap and ensure that we understand the purpose of the next couple of slides, this is really a follow-up to a series of webinars that has contributed to increasing the understanding and building the knowledge around community-led monitoring with civil society across several regions and in partnership with several technical partners. So this one, or today's session at least, is really about how do we unpack this as integral to the broader community system strengthening interventions, and at the same time reflecting on some opportunities that we think we could strengthen going forward, looking ahead at NFM3. So what I will cover today is just a quick recap on the Global Fund support for community-led monitoring, a couple of points on the catalytic effects of community-led monitoring that we have seen in Global Fund grants, looking ahead at CLM and NFM3, and there's several caveats to that, but I will share at least our initial thinking, and then how to ensure CSS investments in grants, and I've separated this for communities and GMD and CRG. And then opportunities for continued support to engage communities and civil society. And as Olive said, there'll be a Q&A after my presentation. I'll be as quick as possible to allow for some time afterwards. So just to recap, in terms of what the Global Fund supports around community system strengthening, I'm sure all of you are very aware of the 4 priority interventions captured under the Resilient Sustainable Systems for Health module in the modular framework. And each of these interventions are then further unpacked, providing illustrative examples of what these activities can include and what would be eligible for Global Fund funding. It, of course, can be applied across the diseases and requires differentiation based on the target community or the population. On the right-hand side, you'll see some indicators. There's a specific one indicator, CSS1, I think it's called, around the percentage of community-based monitoring reports that's presented to relevant oversight mechanisms. I'm sure you can resonate and agree that there needs to be some strengthening of the metrics around community-led monitoring to really directly link it to, let's say, disease objectives, grant objectives, and outcomes. And so this is definitely where I would really appreciate continued engagement and prioritization and inputs from yourselves as this thinking evolves and as we're going ahead, for example, with the next Global Fund strategy development. These are just some illustrative examples of what CBM can include, as well as the sort of a definition that the Global Fund has agreed on in its technical brief on its understanding of community-led monitoring. And also, just to give you a brief update, there are several conversations. There's also a UNAIDS program coordinating body technical task team that's been established to specifically look at these definitions, including community-based and community-led monitoring, community-led service delivery, and so on. And so we are working in close partnership to, one, inform those definitions as the Global Finance CRG department specifically, and so these will be updated. But in terms of activities to include, barriers to accessing services, and a wide array of them, depending, of course, on community needs and contexts and circumstances, tools and equipment to conduct and implement community-based monitoring, technical support and training, specifically around, I think in the guide, it's 6 steps for a CLM mechanism. And it could be technical support and training on each of those, and to also think about relationship building and opportunities and entry points for advocacy. And then obviously also using that CLM data to advocate for change, whether it is policy reform, whether it is a quality issue, whether it is something that's really just a barrier at a very local level that is stopping somebody from accessing prevention care, treatment, and support services. Some of the catalytic effects we've seen in Global Fund grants, I'm sure you're aware of the Western Central Africa Regional Treatment Observatories. The results are significant in terms of what independent monitoring of communities on the services that they access and receive has led towards. You'll see that, for example, on figure 2, the average length in days of art stockouts in the region in monitored facilities in Cote d'Ivoire decreased significantly. And there are several of these in ITPC's annual reports, and we can further flesh them out. I just wanted to touch on these and just let you know that this was an 11 national network project with people living with HIV, collecting data from 125 facilities over a period of 2 years. And in that little sentence basically captures the essence of community-led monitoring over a period of 2 years. So it's not an ad hoc activity monitoring at specific facilities where either barriers are being reported or where we know that uptake of services is significantly or low. And then also the community involved in monitoring, independent monitoring in this instance, networks of people living with HIV, but at the same sense, it could be, I'm sorry, communities and around prevention or specific key and vulnerable populations. On the right-hand side, just very briefly, the REACT system has really allowed communities to respond and record human rights violations amongst both HIV and TB key populations in the Ukraine. And following its successful pilots, there's a national scale-up planned for the rest of this year, and there's continued discussions about implementing REACT in Kyrgyzstan, Tajikistan, and so on. So looking ahead at CLM and NFM3, and like I said earlier, there are several caveats to this slide and all my talking points. As you can imagine, we are getting a significant amount of grants ready for to start implementation 1st of January with delays in COVID. So analysis of these funding requests, of the TRP issues, of the responses from country teams on the identification of TA needs are very much underway. And across the 6 CRG regional focal point and thematic advisors, we are really trying our best to keep track of all these across different regions. And like I said, my support region is High Impact Africa 1. So at least I can speak for some of those portfolios that I support. But in terms of the interventions that's being proposed around CLM is really along the lines and with integration considerations of how prevention and human rights and gender-related barriers to services are melting together, perhaps in a sort of a community-led monitoring mechanism or tool, and it's really gaining traction. So that's very promising to see. However, there's still quite a lot of heavy lifting around CLM for prevention and quality. So there's a lot of focus on treatment and treatment monitoring and stockouts and environments and so on. But on the other side of the cascade and the spectrum, there is a need for us to think about how do we implement CLM around the prevention cascade or the prevention access specifically, and how do we have to think about tailoring those for different communities. The investments that's being proposed and negotiated, so as you know, GACs are happening and none of the amounts or things like that is really available until there is overall agreement of these grants and it is ready to go for grant signature. It really takes into consideration the differentiation in terms of monitoring needs for specific communities, and in particular cases and where relevant, where there are community health strategies, it's really important to think about how do these community-led monitoring interventions, whether supported by Stop TB Partnership, UNAIDS, PEPFAR, the Global Fund, are feeding into and responding to the objectives of those strategies. And specifically in Ghana, there's been the development of a community-based monitoring framework, talking about the different actors doing monitoring, what are the tools that they are using, and some conversations around how do we harmonize those tools. And so that's kind of coming for Ghana in the pipeline. The new CLM interventions that are being proposed are encouraging to see. Zimbabwe has the sex work mystery clients and the AGYW champions. Again, these are areas that we might not be so advanced in terms of having all the evidence and documentation of how this works, but certainly the EANASO's practical guide provides us with a very good foundational understanding of how to approach the design of a community-led monitoring mechanism. However, I would want to emphasize, and I think Richard spoke about this earlier in his opening remarks, there needs to be a greater prioritization to support the institutional and leadership development of community-led organizations across the spectrum of CSS interventions. And I really say this because without a well-functioning, sustainable community-led organization, CLM mechanisms might fail after a specific time, is hugely dependent on a specific disease or specific donor. And I think we need to think about, and that's what we are doing also, to push CCMs to think about how do we embed this around not only specifically responding to the diseases which are critical, but how do we bring independent monitoring and advocate for the narrative around strengthening uptake of services, strengthening retention in services and quality of services, and use this as a mechanism to make those changes. And then finally, also, we've established very close partnerships and are continuously working together with UNAIDS and its community-led monitoring technical assistance support and project, the Stop TB Partnership, through its One Impact tool and CRG assessments, and of course PEPFAR on several areas, so that we align, that we don't duplicate, that we tap into each other's strengths, and that we are synergistic in our approach, and also kind of, you know, making sure that we are all working towards equipping and building the knowledge of communities in better or in further approaching community-led monitoring with some real practical guidance. So I just wanted to quickly, as my final slide, I think, touch on the request from IANASA was really about how do we safeguard CSS investments in grants. And I think this call specifically speaks about the grant making period. And I'm very aware that there are several countries that are still going to write funding requests and submit. But I really wanted to just share some of my own thoughts with you around the role of communities in civil society, the GMD, which are the country teams, and then the Community Rights and Gender Department. I think the role of communities in civil society is so critically important to raise any issues, to raise red flags, whether that is to the Global Fund Secretariat directly, but as a first strategic entry point, it's really important that communities have access to the CCM and the CCM decision-making mechanisms, whether it is through the community representatives or the key population representatives on the CCM, to constantly participate throughout the CCM processes, decision-making prioritization around funding request development, its finalization and final submission, the TRP reviews and the issues that were brought forward. And so communities need to, I would urge communities to be involved with the CCM. And to my second point, I think it's also important to talk about the responsibility and the role of the community CCM reps and feedbacking information about the CCM decisions or items under discussion or negotiation at the CCM back to constituencies. I think this would really help in terms of reflecting whether there are any major gaps, whether there are any omissions that has not been taken into consideration that might have been brought forward by communities in the beginning, and how we now call it falling through the cracks down the line in the process. And then a really good example is the Zambia CCM website to really enable access, just transparent and open access to key information throughout the processes, sharing information openly about when the next CCM meetings are, when are the oversight meetings, uploading the minutes of the CCM meetings so that communities can reflect on those, and also for the community CCM reps to take that into consideration when looping back to constituents. In terms of the country team and grant management division, the country team's core objective is really to ensure value for money, that the grant and the investments are strategically focused, and to support interventions which responds to gaps identified. As you know, gaps, Global Fund is a gap funder, and so there are several aspects that comes into play, which then brings me to the role of Community Rights and Gender Department, and myself and several of my colleagues who are advisors. Our role is to support country teams and communities to protect the community-led investments, to ensure that these CSS agendas are responsive and transformative across the House, across the Secretariat, working with different departments within the Secretariat to support community CCMs and PRs in this process specifically, working very closely with PRs to further develop their program implementation plan, think through the implementation arrangements, refining and getting the budgets finally ready, going activity by activity. And then, of course, also to support and liaise with civil society to raise issues and of particular importance if civil society or communities feel that they've been marginalized or excluded in any Global Fund processes. The CRG department is here to liaise and to usher that process through and to support communities to raise these red flags in the relevant mechanisms. Continued support for communities and civil society is the CRG technical assistance through the CRG strategic initiative, which really supports development of CSS strategy, conducting some analysis of human rights barriers, key priorities and charters to be developed, and for communities to continuously engage in the Global Fund process and meaningfully so. There's also the CRG regional communication platforms. If there are specific issues that's not clearly understood by communities, let's say from the CCM, there can be a request made to the platforms. And IANASO is the host for Eastern Southern Africa or Anglophone Africa, and RAME for Francophone Africa to access this kind of support. And then finally, Alabditsa will provide an overview, but the Community-Led Monitoring Strategic Initiative is really to support the strengthening and scaling up of community-led monitoring mechanisms as much as possible where they have either started in the current allocation cycle or are promising and being proposed for the next allocation cycle. And so the technical assistance will be very tailored. There's several long-term priority support countries based on an initial analysis that we've done. And then there's also a demand-driven pool of technical assistance that will be available for community-led monitoring implementers and to access for specific support. And we are happy to share further information around that when it is ready. We're just preparing the strategic initiative to also go to the grants approvals committee, similar to the funding request process. So that's happening later in this month, about 2 weeks' time. So I'll stop there and I'll happily take any questions, reflections, and comments.
Thank you so much, Keith. Thank you for the presentation, taking us through community system strengthening and how community-led monitoring is a key component there. And also giving examples of what has worked, and mainly around the CLM strategic initiative that just has happened. I am going to keep you on hold. You have 3 questions in the chat box, and maybe let me just say, there's a question from Baram, who is asking, how do we engage the ministries of health to appreciate community system strengthening and specifically community-led monitoring? There's also another point from Noliet Kabanyana from Rwanda, who is also asking, are there any capacity development opportunities around community-led monitoring, specifically for civil society and communities, so that we can increase their knowledge and this can facilitate engagement? There's also another point that has come out from Eric, who is asking, where should these data collectors come from? But I feel like Eric's question, we should put it on hold until Rhoda comes in. I am going to make you just reflect, give you 2 minutes to reflect as I give the floor over to Sophie. Sophie is from GIZ Backup, And GIZ Backup has been a very key partner to EANASO, especially as we developed the guide. So can I, Keith, just give you 2 minutes to reflect on that and open up to Sophie. Sophie, please come on in. Thank you.
I just need to quickly the perspective backup onto community-led monitoring. So we've worked in the past few years with a couple of community organizations to provide direct technical support to community-led programming and monitoring. And then one angle on this topic that we worked on with EANASO and with RAME was the nexus between the findings of community-led monitoring and on the one hand, and then on the other hand, national coordination platforms, specifically CCM oversight committees and funding request development. So really, we were interested in how the intelligence and the knowledge and the data of communities can really benefit grant programming and oversight. So that's something that we have been thinking about over the past few years. And then we've also been privileged to take part in some of the conceptual work and the discussions on community-led monitoring of the past 1 or 2 years. I think all our thinking has evolved quite a bit on the topic, and it's been really exciting to be part of that process. So for example, we supported the EANASO's community-led monitoring guide. We're working right now also on getting it translated to really increase its access, because we think it's a really valuable tool. And then of course, there's also been so much other thinking. So we were really, we really appreciated the CLG units, community-led monitoring brief, and a number of other publications that have come out of this topic. So I just wanted to say that we've appreciated being part of these discussions, and also now going into our next project cycle, we very much intend to continue supporting community-led monitoring projects. Thank you.
Thank you so much, Sophie. And EANASO also appreciates a lot the support you gave us in terms of the country coordinating mechanism plus project, which has led to the development of the CCM guide. We know that this is a partnership, and there's more to do, and there's more, especially at the community level. Now, moving back to Keith, could you just give us, explain the questions from Baram and from Noliet? Over to you, Keith.
Thanks for those questions. So the first one around engaging the Ministry of Health to support community-led monitoring. And again, I think we also have to think about it as community systems strengthening overall in terms of supporting resilient and sustainable systems for health. But the Ministry of Health has a seat and is a representative on the CCM. As I spoke earlier, a key strategic entry point is through the CCM to raise issues and to raise flags. But I think also at the different levels of how community-led monitoring is supporting and ensuring or supporting or strengthening access to services. I think what's important, and I have emphasized this in earlier discussions when we were talking about CLM, I think just in the beginning with a series of webinars, the importance of documenting, communities to document in any shape or form their community-led monitoring approach and mechanisms, and ensuring that they know who represent them on the CCM and convey those evidence, that data, that information to the CCM. And aligned to that, there's also support through the CCM Evolution SI to be provided to several countries, in fact, to support CCMs to use and integrate community-led monitoring data into its decision-making. processes. And so more information about that will be shared, I'm sure. I don't want to put anybody from the CCM Hub on the spot if somebody is on the call, but happy to provide further information on that too, and the thinking around that. In terms of capacity development support for civil society and communities to increase knowledge, I think there's several things underway, and Sophie mentioned the technical briefs and the overview and the other briefing documents, including this video that was played just now around building the capacity. And I think the regional communication platforms has done an excellent job in ensuring that there are constant conversations around this topic and making sure that these are translated back into practical guidance like the INASO guide for communities to access. So further capacity building support, if it's not possible or eligible for capacity development through Global Fund grants, it would be important to reach out to the regional communication platforms who also has access to knowing what are the set-aside technical assistance opportunities from other donors and technical partners, and how to leverage and access those, working closely with colleagues in the CRG department overseeing the strategic initiative. Yeah, I think I'll stop there, and I hope that answers your questions.
Thank you so much, Keith, and thanks for responding to those questions. There is another question, but I think those ones are related to community CLM data collection monitors. And I think let's have that conversation after Rhoda presents. But I just wanted to give 2 minutes to Richard. If you can come in just for your remarks, and then Rhoda, please be on the standby. Oh, there is another question. Keith, if you can just quickly look at the question that is coming from Baram and Gabriel, immediately after Richard, if you can respond to that. And after you finish, Keith, we'll now be moving on to Rhoda because of time. Thank you. Richard, over to you.
Yeah, thank you so much, Olive. Quickly, I just want to say, in terms of engaging the Ministry of Health, what we've done here in Uganda is that documentation is very important, and evidence-based documentation is key. And so one we used, for example, for issues around the LGBTI community and other key populations, we started using React. So in 2017, using React, we were able to document cases within the health sector. And using that report, we're able to engage the Ministry of Health and also the different colleagues within that ministry. And that has also built on a dialogue and conversation in terms of how the ministry responds to the issue. So I would quickly want to say that for ministry, I think as communities, let's document and have clear methodologies and practices and everything, and start the dialogue. Also use that information to engage at the district level, at the regional level, but also at the national level. I think that would be a very clear and quickly on the issue of data collectors. I think, again, we are seeing CLM community-led monitoring monitors from the community. So specialists from university or anywhere, but this should be people from the communities, people who got the facilities. This should be the key populations, and all we need to do is, what are the tools? Train them, empower them, and deploy them. And trust me, you will achieve the results. Thanks.
Thank you so much, Richard. Keith, I think there's only one key question. The questions from Baram and Gabriel will be responded after Rhoda's presentation, but there's one from Miriam who is asking, will the CCM members be provided with resources to implement CLM CBM? If you can just respond to that question, please.
I think there's maybe just a clarification that I might have. Implement CLM, I'm not sure I understand the question. CCM members will be provided with special trainings and additional resources and tools for them to be able to use CLM data in CCM-related decision-making processes, whether it is reflecting the grant needs, program needs, community needs, and so on. And to enable and to support the advocacy strategies that needs to follow from the presentation of, or the analysis of the data and the identification of the major issues, and also thinking about some recommendations going forward. So in terms of the CCM members itself, there will be efforts to increase their knowledge, to increase their understanding and their appreciation and their acknowledgement for community-led monitoring data. And then there will be support for the community representatives on the CCM to make sure that there's a capturing of all the different CLM data, because remember, CLM is not a one-size-fits-all approach or a stock standard cookie-cutter method. It has different. It needs to be contextualized, and so different communities will have different needs and different tools, and so it's bringing all of that to the table of the CCM decision maker. Over.
Thank you so much, Keith, and thanks for that response. Now, can we quickly move on to Rhoda? I apologize, we will not be taking hands now because we have 2 presentations that need to be done. And then after that, we'll have another session where we share experiences. I'm encouraging everyone to use the chat box because it actually saves us time and we are able to respond to more questions. So please kindly, if there's anything that has been left unresponded to, Keith is still on the call and can respond to them within the chat box, or if there's space for us to interact once more. I am now kindly introducing Rhoda Lewa, who was the technical consultant that supported the development of the community-led monitoring guide. She was also part of the team that supported, specifically Rhoda supported the Malawian country task team to come up with their priority charter, and also know your grant key document, which also should be, I think is a document that we will be sharing with you. Rhoda, can I request you to come on in? And if you can just put your presentation on slide view. Thank you.
Good afternoon, everybody. Can you hear me?
Loud and clear.
Yvonne, can you please assist with sharing my slides on my, I'm having technical challenges on my side, but yes. I will, sorry?
Yes, Yvonne will be.
Yes, I'm seeing.
Thank you very much. I'll proceed. As mentioned by my colleagues, Olive, my name is Rhoda Lewa. I'm an independent consultant based in Kenya. And this is a follow-up webinar. The last webinar we were unable to finish because of the richness of the discussions. And it seems like also today we'll have the same similar challenge. So I will really try to squeeze in the 2 presentations into almost like one presentation. The first presentation is actually around conceptualizing, design, and implementing CLM mechanisms. Now, this is really a very straightforward thing to do. Is the presentation up? I can't see from my side.
Yvonne, can you kindly put up the presentation? But we can see your presentation, Rhoda. Only
you can?
that, yeah, we can see your presentation, but you just need to start from the beginning. It's on slide number 9. So if you can move upwards.
Excellent.
Yeah.
All right. Excellent.
Go some more.
Yeah.
Go up.
So thank you.
Up, continue. Go
That's
up.
it.
Yeah, that's the first slide. Yeah.
Yes. So I won't dwell on definitions because these are on the guide, and also the video provided a good background of what CLM is in the interest of time. I want us to remember this slide because it summarizes the funding cycle and the important stages. And if you go into the guide and refer to the guide, it will actually highlight for you the entry points or the windows of opportunity for you to actually integrate CLM. So whereas we have an integral part, which is developing of funding request, the discussion around CLM needs to happen before you actually start drafting your funding request, during the country dialogue, during the NSP development, and the evaluation of the previous NSP. Again, I won't go into detail because it's very straightforward in the guide. some questions came up from the last webinar, and again, just to summarize, is when you're thinking about CBM or CLM, it's very important for you to understand the principles that govern community-led monitoring. And for this afternoon, in the interest of time, I just want to focus on number 3. That is, CBM is objective and transparent. What does it mean? Maybe I just do a quick run for all of them. CBM is about community empowerment. What does it mean? It's actually about empowering communities, the actually service users, the end users, the people who use the commodities or the condoms or the lubricants, to actually understand in terms of their rights as patients or service users, so that they can actually, from in quote unquote, wearer of the shoe perspective, tell us what is working and what is not working. And if something is not working, then they can make some useful noise in order to result to improvements in service delivery. So it's all about community empowerment. It's community-led and driven. What does it mean? It means that Keith cannot design a CLM initiative from Geneva. Again, the grassroots people have to be engaged, part of the discussions, conversations in terms of defining the objectives, the indicators to be measured, and even the strategies to be used. In terms of objective and transparency, what does it mean? It means that a peer, for example, who is to some extent an implementer of interventions, or the government, to some extent, an implementer or a service provider, cannot actually deliver a CBM or a CLM mechanism or initiative. Why? Because if there are issues to be found, they'll be found on the government side or on the peer side or a specific private entity. So it's very important that conflict of interest is not inherent when between the implementer and the person to whom the advocacy will be targeted. I think that will become much clearer as we proceed. But there was a question last week, and I thought I would actually highlight these principles. Again, refer to the guide, very explicit discussion. I'll stop there in the interest of time and go to the next slide. So these are the 7 primary steps when designing, conceptualizing and designing a CLM mechanism. Like earlier mentioned, it starts with the community empowerment phase. And once the community is empowered, the service users, whether it's key population or people living with HIV or women on PMTCT or AGYW, as we have heard from Zimbabwe, or just pregnant women who are eligible to receive mosquito nets. Those need to be empowered to actually understand CLM, to understand why they need to give the information, to understand why they need to learn to speak out when things are not going as they should be. The next phase is planning and conceptualization. And this is a very integral step, because on paper, during the planning and conceptualization, you should actually have defined your entire mechanism. You should know what objectives you're going to use. You should know whether you'll require government clearance to collect data and ethical approvals. You should know your data collection tools, whether they'll be paper-based or manual. You should have discussed again with the stakeholders, including the communities, whether you're going to use paper-based or mobile-based, whether you're going to use Google apps. You should know, you should by this time have engaged your constituency, at least provided for constituency engagement with on paper. So at planning and conceptualization phase, you should actually have envisioned the entire CLM in ideally a concept note or a proposal. Once that is done, then you initiate stakeholder engagement, and stakeholder engagement is actually appreciates that CLM is not done in isolation. So it's not about a civil society or communities jumping to region X or province Y to do collect data, but is actually engaging. There's a whole elaborate entry process that has been defined in the guide so that you are able to engage your Ministry of Health or maybe your district health committee or your county health, so that they understand also CLM, and they know that information is going to come in terms of findings from the mechanism for their consumption to make better decisions in order to improve service delivery. And this ties very well to the point that Keith was talking towards the end of the last question. The information that is generated by a CLM actually also feeds as a sources of information to the Oversight Committee on the CCM, again, to make important decisions in terms of what needs to change or what needs to improve in order to improve the service, the quality of services being delivered. Once you do your stakeholder analysis and you have your tools, you go into the data collection phase. Of course, the tools have to be pre-tested, the data collectors have to be trained and oriented, and pilot runs have to be made, and so that the data collection, triangulation, and reporting is perfected before actually doing the actual rollout. So those are questions: where do the data collectors come? The data collectors have to be the everyday service users. So if your mechanism is KP specific, you cannot expect Rhoda, who is not a KP, to be a data collector. I cannot. It has to be the wearer of the shoe, and I'll leave it at that. But again, information has to be processed, analyzed, to develop very explicit findings, to generate very explicit findings. Again, Rusimbi has talked a lot about this: evidence, evidence, evidence. Once you have evidence, then you have credibility, you have validity, and you can actually take it to the mountain. You can knock every door and say, this is not working as it should be. Again, I will stop there for now because I'm very much interested in the other presentation, which we did not cover. A lot of this we covered last week, and it's also very straightforward in the guide. So allow me to jump to the other presentation. Thank you.
Thank you, Rhoda. Please do connect to the next presentation. Colleagues, as Rhoda is putting up her next presentation, if you can quickly, if you have a comment or a question, put it in the chat box. Because of time, we would want to cover as many questions as possible. So please let us use the chat box. Go up, okay. Rhoda, go all the way up.
Thank you, thank you. And this for me is a very important presentation. It's basically advocating and consolidating CLM during the grant making phase. So what is grant making? It's, of course, it's a key step, but I like being graphic, so I'll jump a few slides and then I'll speak to this slide. I'm not sure if you can all see me. See the slide? Oh.
We can see a slide, the grant making phase of the Global Fund grant slide. Yeah.
Just that funny things are showing on my slide.
Uh-oh, what's happening?
Okay. Can you see all the?
Yes, Rhoda, I think what has happened is your slide, it moved from the center, so it's gone downward. So we can see partially see it. Yeah. Just a reminder, if you have a comment, if you have a question, let us use the chat box. I think already we were talking about the community monitors, the data collectors. So kindly put on the box. Rhoda, why don't you just like that?
I think I'm good now, yeah. Thank you. Yes, so this slide actually summarizes the funding request. As if you look at the dark blue section, it's written grant making stage, and that's a very important stage in from funding request to actual funding coming into the country. Once the funding request is developed, then it's submitted to the technical review panel. And once the technical review panel approves or generates questions, the CCM has to respond to the questions, and once satisfied, that the technical review panel okays the funding request to move to what we call the grant making phase, which is the cornerstone of this presentation. What we need to understand is once the board starts moving from funding request development, starts moving to TRP, to grant making, to GAC, it doesn't provide for backward linkages. It's just moving forward from one step to another. So from our perspective as civil society, we should be clear in terms of understanding what happens if the TRP does not raise any questions with respect to community system strengthening or with respect to community-led monitoring. If there is no questions, like in a number of countries that I've worked with, it means that the TRP is actually satisfied with what has been presented by the country in the funding request. So there's nothing to raise, and then it is approved to proceed to grant making. So that's a very important stage, and we'll come back to it in a bit. Again, these are very straightforward questions. But possibly for purpose of just clarity is to understand that whereas the funding request is a CCM-led activity, the grant making is purely PR-led activity or process or phase. And when it comes to grant making, which is a PR-led process, then you need to ask ourselves as civil society, to what extent does the PR understand CLM and the importance of CLM? So there are countries which have dual track financing. They have a civil society PR and a public sector PR. But what is the relationship? What is the understanding of CLM by the PR? Because if the PR has zero understanding, they'll not be able to defend it. If it's single track financing, if the government has no understanding of CLM, then they'll not be able to safeguard it during this important phase. And lastly, we also have countries where we have COE countries where the PRs are actually appointed or nominated or selected in a very different way because of the risk levels that are inherent in COE countries. So whoever the PR has been appointed in a COE countries, what is the understanding of CLM? Because if they don't understand, then they cannot be champions for it. And this process is actually PR-led. So even if you have your civil society member and CCM member who is a big advocate of CLM, but there are no alliances at PR, then it's really, really frustrating. Also, important stakeholders who participate during grant making are the country teams, the LFA, technical partners like WHO, UNAIDS, GIZ, PEPFAR, and others in country, CCM members, especially those from civil societies and communities, as well as the CCM Secretariat. What are the outputs of the grant making is actually to have a comprehensive list of health products, to have implementation arrangements, to have finalized performance frameworks and budgets. So I'll just go back to this slide once more. So if you look at the dark blue block on grant making, and then the follow-up which says CCM, under CCM oversight, PR submits grant documents to the GAC review. As civil society, we need to be conscious, we need to be alert to ask ourselves, to what extent is what is being submitted by the PR to the GAC review corresponding to what the CCM submitted to the TRP? I don't know whether I'm communicating, but there is a block here called TRP. It should be TRP, and TRP receives from the CCM and the CCM and the TRP are satisfied. Once satisfied, they present that to the PR for work, and then the PR submits to GAC. So in terms of quality assurance, what has changed, what has not changed? Is the CLM or the CSS interventions which were defined at the beginning, are they secured, are they safeguarded? Have they been underfunded? Have some been reviewed? Because GAC will not go back to look at what the TRP actually, what has changed. GAC will pick what the PR has developed, of course, with the support of the country team, the CCM and the country partners, and move on with it. But what experience has taught me is that things happen during this particular phase, and I'll just share with you this slide, which is from a country in Africa, of course, where things changed. And you can see, for example, all these are under resilient and sustainable systems. The first one was health products management. In the funding request, it was 3.1. And then during grant making, there was some downsizing that was done. But I want us to focus on community system strengthening, because it is under this budget where community-led monitoring is. So the initial allocation was actually $2 million for 3 years. This was after a lot of push and pull. After grant making, it was downsized to 700,000 over 3 years. Now, during Keith also raised 4 important interventions under CSS. You have community-based monitoring, you have institutional support, which is actually targeting PLHIV networks for women, and national networks for men, and also for national KP networks if they exist, or national CSO networks if they exist in country. Then you have another intervention on advocacy and another one on mobilization. So try splitting 700,000 over 3 years across those 4 interventions, or maybe just take 2. But in this particular country, all the interventions were dropped, and the 700,000 is actually split between the National Women PLHIV Association and the National Male PLHIV Association, and it's basically going to salaries. So no community responses, and of course you can see the variance there. So grant making phase is very, very important, because if we are not empowered enough, if we are not following the money, if we are not participating actively at this table where the cake is being shared, then at the end of NFM3, we'll come and ask ourselves, how well or how poorly did we perform? Of course, we'll not have performed as well, because at the end, there was actually no money for CLM. And if you ask the TRP, they'll say, yes, we had money for CLM and community system strengthening. But again, it's watered down. And if you start grant implementation, there's something that is called, what is it called? I've forgotten. Reprogramming. So we haven't even started reprogramming at 706,000 over 3 years for our whole country. And then by the end of 3 years, combined reprogramming, you'll find that actually less than half of that money might actually have trickled down into community system strengthening. So again, this was just to say, why is that important? That is why this grant making phase is very important. So if you're participating in the grant making discussions of your country and you're not empowered on CLM or CSS, then it's actually a disservice. And my mom used to be a teacher, and she used to say, there are those who go to school and there are those who take others to school, because when others pass, others are not doing very well. So if you're not empowered on community system strengthening, if you're you're not empowered on CLM and your community representative participating in getting those who know in terms of government and other partners, implementing partners, who make sure that the interventions actually are well provided, none are dropped, and actually receive adequate allocation. So how then do we improve our participation during grant making? We need actually to come up to follow up. This is actually a grant making checklist, but it's under development, it's not final. It's basically to ask ourselves, which civil society and communities are participating in the grant making phase, and what is their understanding? To what extent are they empowered or disempowered? The second aspect in the checklist is in terms of funding request development. Funding request is part of resource mobilization. Resource mobilization, when we do fundraising, we say it's a relationship building. So if the CCM and our civil society representatives on the CCM are supposed to be our civil society representatives, how are they engaging with those of us who are not on the CCM? How our representatives, when do they have one-to-one or just dedicated Zoom with country teams? How are they engaging the PR? You know, because if you don't build the relations with all those who are involved in grant making, then you're doing a disservice to yourself. The other relationship is with the LFA and the Oversight Committee, and especially the PR, because the PR has to buy into the CSS agenda and the CLM as an important and integral intervention of improving the quality of service. This one I've also talked, understanding about CLM and CSS.
Rhoda, if we can also be summarizing, please.
Yes, please. Again, this I've talked about, the TRP comments, were they received by the CCM? Yes. Did they have anything implication on a CLM or CSS? Yes. It's a good thing there was nothing. But then how do you move forward to safeguard that? We have already discussed that. And then what is the relationship between the technical, the TRP approved interventions in the funding request and the performance framework and budget prioritized interventions, which are now going to the GAC? Is there a mismatch? Again, this even some people have inboxed me today here that there are some countries that saying that there's a mismatch, but what are your recourse options? How do you correct? One of the countries just said that the allocation for CLM has gone to health system strengthening for community health workers who are under the Ministry of Health, under the Community Health Department. So what are the recourse options? Where should such countries run to in order to correct this? Because before it moves to GAC, because if it moves to GAC, then it might be a little too late. Checklist implementation arrangements. Which SR is proposed for CLM? This SR, are there a community member? If it's KP, if it's AGYW, if it's sex workers, if it's pregnant women for malaria, is your SR an implementer, an active player currently, or do they have conflict of interest? Because if they have conflict of interest, then they're not best placed to actually deliver on the CLM. And then the issues of conceptualization, that one we have already talked about. A few tips: establish a task force for grant making. Once you establish this task force, empower it. Number 2, identify your champions. Sometimes it's very disheartening as a consultant to see how civil society carry themselves as if they're fragile, they're very important, they sit on their own silos, they don't engage, they want to be followed up on all the time, and it's really a burden on the secretariat. But if a country has proactive civil society and community representatives, then they will have the champions on speed dial. Where will the champions come from? They'll have champions in the country team, they'll have champions amongst other CCM members, they'll have champions amongst technical partners, bilaterals and multilaterals on the CCM, and as well as their respective communities. numbers. I don't want to get into this, but civil society and communities have numbers. Unfortunately, they've not been able to turn around these numbers to advance the case for community interventions and community responses. Why? Compartmentalization, subject for another day. Dedicated grant making. How many countries have finished grant making, and how many countries had dedicated technical assistance for grant making? I think that would be good reflections for you, Keith, because you can see a lot of investments on CSS and CLM have been watered down because of the turnover within the CCM. Maturity levels and even understanding and knowledge management level for CSS and CLM is capacity building is a continuous process. So if there is new members on the CCM and they are not, they're being exposed to grant making and funding requests on the very first time because they are new, they just joined 2 years or a year ago. So they are not capacitated enough. But again, the TA either didn't come or came too late. So they went to just participate in grant making without full capacity, and they were not able to make the best for their respective communities. Advocacy, again, for grant making phase, we really need to raise these issues. If the funding request and the outputs of the grant making, the outputs of the TRP and the outputs of the grant making are significantly changing, then we need to advocate, we need to engage broadly with the PR, using evidence, as Rusimbi has said. Why is this? How are we going to survive on this? Are we going to survive on 700,000 across 4 interventions, or even if it is 2 of the CSS interventions over 3 years, including institutional capacity building, where we want capacitated, support capacitated organizations with staff and equipment so that they can actually make a difference. Engage with the country team, LFA, CCM members, including the oversight committee. And lastly, is raise concerns in writing and via calls with the FPM and country team. And remember to CC all relevant stakeholders and seek formal responses and corrective action. Because if you leave it without putting it on paper, then follow-up becomes challenging and it can easily be lost. It's very weighty for a CCM to receive a complaint in a meeting, and in a CCM meeting, in a routine CCM meeting. It's very different from receiving a letter which has been CC'd to the country team or the FPM or all the CCM members, including the bilaterals and multilaterals. So it's weighty and very important to put your concerns in writing. Thank you.
Thank you so much, Rhoda. Thanks. And I can see you've taken us through 2 very key processes. The very first is in terms of how do we ensure that we have a community-led monitoring system. And I think that was your very initial presentation. But then your second presentation, you're taking us through opportunities or the places where we can lose when it comes to community-led monitoring. It's already been included within the fund request. Where can it be dropped off? You've taken us through that and even provided us with tips. So now I don't want to talk long because I know we are out of time. I am going to request 10 minutes because right now is the time when we're supposed to have finalized this call. There were 2 points, and I just want to put this in front of you. There's both Eric and Betty had asked a question in terms of community-led monitoring, data collectors or monitors. How do we ensure that they can, that they can freely work with our ministries of health? And I think this is in terms of making sure that they are able to collect information freely. And there was also a question of where do they come from? I would request you, Rhoda, to go to your first slide, take us to that slide which had the cycle that had those key areas, and probably if you can explain that a bit further. There are also some, there's also a comment from Baram. how do we ensure that there's no competition among a civil society for community-led monitoring opportunities? If you can also respond to that. So those are the two key things. I know that there are so many questions from Aaron Sunday, from Tajuddin, and congratulations, Tariro, for saying Zimbabwe, you've already included community-led monitoring. And I think there's also Angel who has talked about the directional scope of community-led monitoring. So Rhoda, if you can respond to the questions on the monitors, how can we work in close partnership with our ministries of health so that we are not like we are in confrontational, but also amongst ourselves, who leads that process? Over to you, Rhoda, and I'm giving you 5 minutes.
Thank you, Olive. Allow me to respond without necessarily going to the slides. Slides take a lot of time. In terms of the monitors, a monitor is actually a service user, and if I want to say it in a different words, is actually the wearer of the shoe. Somebody who goes to hospital for ARVs or for TB treatment, or a mother with a young child under 5, or a pregnant mother who goes for either PMTCT or just might not be HIV positive, but might be going for routine antenatal clinics and is eligible to get mosquito nets, and also mosquito nets for the young under 5s. So it's a service user. It might be a KP who is going for loops, or might be a sex worker who is going for sex, but it's a service user. So you cannot have a community worker, like I saw in one of the countries under the last grant. Their monitors were actually based at the capital, and they were going to the regions one period or another. No, that is not a normal service user. That person is going to do inspection. The Ministry of Health already has supportive supervision, has a whole supervision framework for quality assurance. So you don't need to duplicate that. But the day-to-day service user who will be using and documenting that experience in terms of what is working and not working is your ideal community monitor. In terms of how do we work well with government, if you go to the cycle, if you look at the guide and the cycle, there is a phase there for stakeholder engagement. You have to introduce CLM to government at various levels, from the grassroots, that is health facility level, to the county, to the district, or to the sub-district, or to the sub-county, up to the national level. So that when you generate your information, you can actually go back to them and say, since we came here, this is what we have done. And the evidence is telling us that the number of days where we have drugs and the number of days where we have stockouts, the days of stockouts are more than the ones when we have drugs. So how then can we end the epidemics if we are continuing to have stockouts? So that you have a positive conversation and discussion in terms of how to actually overcome the challenges, and then which then results to improvements in quality of service. But just flipping you back to grant making, you're not even going to get to grant implementation if there is no money for CLM. So first things first, how is your CLM designed? How has it been funded? That money, is it enough? Do you have stipends? Because this business of asking community monitors to volunteer their time, their bus fare, their airtime, do you have stipends? Do you have data processing? Do you have money to do good advocacy reports? So it's very important to make sure that your CLM is adequately funded. That is within the realms of Global Fund funding. But if your CLM mechanism is funded outside, again, it becomes outside the Global Fund. It's easier to have a different type of conversation. But within the Global Fund, grant making phase is, funding request is cooking. Grant making is serving. you need to be on the table, and you need to make sure that you're adequately served with sufficient funds to implement CLM.
Yes, Rhoda, there was a question on competition. I don't know whether you responded to that from Baram, but I also, so if you can respond to that.
Exactly. Thank you, Abdul Karim.
No, I wanted to say, Abdul Kadir, congratulations, because NEP1 is also putting in CLM. I think you are saying that you will be implementing CLM. But Rhoda, as you respond to the question, there are the question on competition, Baram, there's also Ibrahim Umuro who is also commenting on that it is key, the housing, where should CLM be housed? Because it all goes back to competition among civil society. I want to hear your point, but then there's also a key question coming from Wanjiku Kamau saying, yes, the grant making, but what is it we are monitoring? So if you can just respond to those 2 points, the housing competition,
okay, thank you.
The what?
I'll start with Wanjiku. This is the last week presentation, which we couldn't go into in the interest of time. What are we monitoring? We are monitoring what is not working, what is seemingly not working. So this is an important part of the design, conceptualization. You have to determine what is it that you're monitoring. You can either have a dedicated, for example, CLM mechanism for purely PLHIVs, or it can be integrated PLHIVs, including TB, including KPs. But there might be something very specific that is unique to women and children because of the data which is coming out. So you might want to have a dedicated CLM on women living with HIV or on AGYW as in Zimbabwe. So it has to be evidence-based, but there's also opportunity to do CLM across diseases, depending on how you set your objectives. But again, also questions of scale come in. Do CLMs have to be national-wide? No. They can be contextualized in a county, in a region, in a facility, depending on availability of resources and your own objectives that you want to meet. So as you can see, the space for CLM is big. Should everybody do CLM? Yes and no, it's tricky also. Keith talked about CLM for prevention services. It's tricky, but and even if we all decide to do CLM, we can't all get the funding because the funding is always limited. So it's very important to prioritize that. Yes, there's a lot that is not working, but can we start on this? On priority 1 and 2, and once that is improved, then we can do something else. Consider also value for money. Value for money can allow you to actually have indicators on HIV and TB and also KP in one CLM initiative. So those are the things to take into account, because if we don't work smarter, civil society will not go too far. Who is best placed to do a CLM or CBM? It's something I've given a lot of thought, but conflict of interest has to be managed. And if you go to countries, you tend to have national networks, for example, of people living with HIV, or you have national networks of CSOs, I think, or national networks of KP. In my opinion, those are best placed to implement CLM because they are not directly engaged in service delivery. They tend to be focused more around coordination, capacity building, and advocacy. And this actually gives them the objectivity and the independence they require to actually be able to host a good CLM intervention. So it will be hosted, it can be hosted by any of those that I have listed, but they cannot work in isolation because they have to go to the office, and maybe they can have facilities that maybe they can do it in 5 districts, and within the districts, then they identify the facilities where they want to monitor. based on the agreed upon indicators.
Thank you so much, Rhoda. And I can see that there are so many other comments, but I had requested for 10 minutes and my 10 minutes is over. What we will do is also just collect all this information. It's very key points, comments, observations, I think that has been put within the chat box. On behalf of IANASO, on behalf of Frontline Aid, on behalf of GIZ Backup, Stop TB Partnership, and the Global Fund CRG team, I would like to thank so much, Rhoda, for your presentation, and the other presenters, Keith, Richard, Lusimbo, and then also appreciate the partnership in terms of coming up with this community guide. What we are going to do is we are going to combine the two webinars, the initial one and this one, and come up with a report, and we will share with you all, because we have your, as you were registering for this webinar, we also managed to get your email addresses. So please look out for that report. We will also share all the presentations, and we're also going to share the video. I think there was someone who talked about the videos. If you have any other questions, please do not hesitate. If you have any points that you need clarification, do reach out to IANASO, especially the Anglophone Africa CRG team. We have Yvonne, we have Mlewa, Glory, myself. And we will also want to thank specifically Revanta, I'm sorry, Revanta from Frontline Aid, because he has worked tirelessly with the team to make sure that we have a guide in place. I would like to thank all the participants for taking your time to be on this webinar. And we know that this is just the beginning of discussions around community-led monitoring, and especially as Keith mentioned, that the strategic initiative is starting from next year. So we will be sharing more information as it comes out. And I also wanted to appreciate Sister Linda Mafu. I saw that you were online. Patrick Brenny, I saw that you were online as well. UNAIDS and Global Fund, we really appreciate you being here. Mostly, I appreciate each and every participant who took their time to be on this call up to this last minute. Asanteni sana, thank you very, very much, and the discussions continue. We are civil society because we know what we live in, and that is to make sure everyone has access to quality, affordable health services. Community-led monitoring is a tool that we will be using. Thank you very much. And with that, I would like to say we have closed up our discussion. Asanteni sana, and God bless you.
Asante na wewe.
Thank you, Ali. Everyone.
Thank you.
Thank you.
Thank you.
Thank you,
everyone.
Thank you. Thanks for a great session.
Thanks for a great section.
You're most welcome.
Thank you.
Thank you.
My thanks go to Rhoda.
Thank you, Olive.
Asante.
Okay, thank you.
Hey, are we happy?
Thank you.
Thank you. Thank you.
Okay, thank you.
Thank you very much.
Thank you, Marie.
Thank you.
Thank you, Stanlos. Thank you. Thank you, Gift. Yeah. Thank you, Emily. Thank you so much, Tajuddin, Samuel, Rehema.
All right.
Yes,
Thank you so much, Kupara from Zimbabwe.
The network is bad. I can't hear you.
Can everyone put the video so that we take a photo?
Oh, yeah. Group photo. Oh, if we can put switch on.
Thank you so much. I'm Ekim Kumba from Zimbabwe.
Put on your video, please. We take a group photo. Those that are remaining, put on your video. Put on your video. Thank you so much. I forgot completely about that. Put on your videos. Put on your videos. We take a group photo.
Okay.
Olive Mutabeni, Imakam, Olaide, put on your video. Enoch Kuntoka, put on your video.
Ora sumudza face yakanyura Olive. Olive Harare sumudza musoro hatisi kukuona.
Ulibo. Hi Stacy, good to see you.
Bye.
Let me take a photo. Thank you so much. Bye.
Thank you too. Bye.
Bye from Nigeria.
Oh, it wasn't. Bye. Bye. Was I talking? Oh, me, I was talking, but he was not talking.
Yeah, told him I was doing something.